Question 1. Performance analysis shows a hospital is tracking the percentage of patients with diabetes who achieve an HbA1c level below 0% within 6 months of diagnosis. This indicator is being reviewed for its contribution to the organization's quality dashboard. Option A, process indicator. Option B, balancing indicator. Option C, outcome indicator. Option D, structure indicator. The correct answer is C, outcome indicator. Explanation. This scenario is professionally challenging because it requires a healthcare quality professional to accurately categorize quality indicators based on their fundamental nature, which directly impacts how performance is measured, interpreted, and improved. Misclassification can lead to flawed data analysis, ineffective interventions, and ultimately compromised patient care. The Certified Professional in Healthcare Quality (CPHQ) exam emphasizes the ability to discern these distinctions to ensure robust quality improvement initiatives. The correct approach represents best professional practice because it aligns with established quality management principles and regulatory expectations for healthcare organizations. Accurately identifying an outcome indicator demonstrates an understanding of what the healthcare system is achieving for patients, which is the ultimate goal of quality improvement. Regulatory frameworks, such as those overseen by organizations like the Joint Commission in the U.S., often mandate the tracking and reporting of outcome measures to assess the effectiveness of care and patient safety. By correctly identifying an outcome indicator, the professional is demonstrating adherence to these principles and contributing to a data-driven approach to patient care improvement. An incorrect approach that misclassifies an outcome indicator as a process indicator would be professionally unacceptable. This represents a failure to grasp the core distinction between what is achieved, outcome, and how it is achieved, process. Ethically, this could lead to focusing improvement efforts on the mechanics of care delivery without adequately assessing whether those mechanics are actually leading to desired patient results. From a regulatory perspective, this misclassification could result in an organization failing to meet reporting requirements for outcome measures, potentially leading to sanctions or a negative assessment of quality by regulatory bodies. Another incorrect approach, classifying an outcome indicator as a structure indicator, is also professionally unacceptable. Structure indicators relate to the resources and organizational framework, e.g., staffing ratios, availability of equipment. Misclassifying an outcome as a structure indicator demonstrates a fundamental misunderstanding of quality measurement. This would lead to an organization investing in resources without a clear understanding of whether those resources are translating into improved patient health status or satisfaction, which is the true measure of success. This failure to connect resources to results is a significant ethical and professional lapse, as it can lead to inefficient resource allocation and a lack of accountability for actual patient benefit. The professional reasoning process for similar situations should involve a clear understanding of the definitions of structure, process, and outcome indicators. Professionals should ask, does this indicator describe the environment or resources available for care structure? Does it describe the actions taken during care delivery process? Or does it describe the results or impact of care on the patient's health status or experience outcome? When faced with a specific indicator, a systematic evaluation against these definitions, informed by the organization's quality improvement goals and relevant regulatory requirements, is crucial for accurate categorization and effective quality management. Question 2. The audit findings indicate a recurring pattern of documentation deficiencies in patient care plans, potentially impacting care coordination and continuity. As a healthcare leader, which of the following actions best demonstrates a commitment to addressing this quality issue within the U.S. regulatory framework? Option A. Classify the documentation deficiencies as minor administrative errors and focus resources on other identified quality initiatives deemed more critical. Option B. Issue a memo to all clinical staff emphasizing the importance of accurate documentation and reminding them of existing policies, without further investigation into the underlying causes. Option C. Convene a task force comprising clinical staff, quality improvement specialists, and relevant administrative leaders to conduct a root cause analysis of the documentation deficiencies and develop a comprehensive action plan for improvement. Option D. Reassign responsibility for reviewing patient care plans to a different department, assuming the issue is a result of the current team's workload. The correct answer is C. Convene a task force comprising clinical staff, quality improvement specialists, and relevant administrative leaders to conduct a root cause analysis of the documentation deficiencies and develop a comprehensive action plan for improvement. Explanation. Scenario analysis. This scenario is professionally challenging because it requires healthcare leaders to balance immediate operational demands with the long-term strategic imperative of quality improvement. The audit findings highlight a potential disconnect between stated quality goals and actual practice, placing leaders in a position where they must demonstrate accountability and drive meaningful change. The challenge lies in allocating resources, fostering a culture of safety, and ensuring that quality initiatives are not merely compliance exercises, but are integrated into the core operations of the organization. Careful judgment is required to identify the root causes of the audit findings and implement sustainable solutions. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the audit findings by initiating a comprehensive review of the quality management system. This aligns with the fundamental principles of healthcare quality as outlined in U.S. regulatory frameworks, such as the Centers for Medicare and Medicaid Services, CMS, conditions of participation, which mandate robust quality assessment and performance improvement, CAPI programs. Leaders are ethically and regulatorily obligated to ensure that patient care meets established standards and to proactively identify and mitigate risks. By engaging all levels of leadership and staff, this approach fosters a collaborative environment essential for effective quality improvement and demonstrates a commitment to continuous learning and patient safety, which are core tenets of healthcare quality. Incorrect approaches analysis. One incorrect approach fails to acknowledge the systemic nature of quality issues by focusing solely on individual performance without investigating underlying process or system failures. This approach is ethically problematic as it can lead to unfair blame and does not address the root causes of suboptimal care, potentially violating principles of justice and non-maleficence. Regulatorily, it falls short of CAPI requirements which emphasize system-wide improvements. Another incorrect approach is to dismiss the audit findings as minor or inconsequential. This demonstrates a lack of commitment to quality and patient safety, which is a direct contravention of the ethical duty of care and the regulatory expectation for healthcare organizations to maintain high standards. Such an approach could lead to significant patient harm and substantial regulatory penalties, as it signifies a failure to adhere to established quality benchmarks and a disregard for patient well-being. A third incorrect approach is to implement superficial changes that do not address the core issues identified in the audit. This approach is a form of regulatory noncompliance, as it fails to demonstrate a genuine effort to improve quality and patient outcomes. It can also be ethically questionable, as it creates a false impression of compliance and improvement while potentially leaving patients at risk. This approach undermines the integrity of quality initiatives and erodes trust among staff and patients. Professional reasoning. Healthcare leaders must adopt a proactive and systematic approach to quality improvement. When audit findings are presented, the professional decision-making process should involve 1. Acknowledging and validating the findings. 2. Initiating a thorough root cause analysis to understand the underlying issues. 3. Engaging relevant stakeholders, including frontline staff and leadership, in developing and implementing corrective actions. 4. Establishing mechanisms for ongoing monitoring and evaluation of the effectiveness of implemented changes. 5. Fostering a culture of transparency and continuous improvement, where quality is a shared responsibility. This systematic approach ensures regulatory compliance, upholds ethical obligations, and ultimately leads to better patient outcomes. Question 3. Analysis of a situation where a healthcare facility's internal audit reveals a significant deviation from a critical accreditation standard related to medication reconciliation, occurring just days before a scheduled on-site accreditation survey. Simultaneously, a patient is admitted with a complex medical history, and the admitting physician notes that the current medication reconciliation process, as evidenced by the audit, is likely to have contributed to a potential adverse drug event for this patient. The quality director must decide how to allocate resources and attention. Option A. Proceed with the accreditation survey as scheduled, highlighting the identified deficiency during the survey and assuring the surveyors that immediate corrective actions will be implemented post-survey. Option B. Focus all available resources on ensuring the current patient's medication reconciliation is flawless, deferring any comprehensive remediation of the systemic issue until after the accreditation survey has concluded to avoid drawing negative attention. Option C. Immediately implement a targeted retraining program for all staff involved in medication reconciliation. Initiate a thorough review of the existing policy and procedure, and proactively communicate the identified deficiency and remediation plan to the accreditation body, while ensuring the current patient's medication reconciliation is meticulously managed by senior clinical staff. Option D. Inform the accreditation body of the deficiency and request an immediate postponement of the survey, citing the need to address a critical patient safety issue without detailing the specific remediation steps being taken. The correct answer is C. Immediately implement a targeted retraining program for all staff involved in medication reconciliation. Initiate a thorough review of the existing policy and procedure, and proactively communicate the identified deficiency and remediation plan to the accreditation body, while ensuring the current patient's medication reconciliation is meticulously managed by senior clinical staff. Explanation: this scenario presents a common ethical dilemma in healthcare quality, where immediate patient needs and established accreditation standards appear to be in conflict. The challenge lies in balancing the imperative to provide care with the requirement to adhere to regulatory frameworks designed to ensure quality and safety. Professionals must navigate this tension by prioritizing patient well-being while upholding the integrity of the accreditation process. The correct approach involves a commitment to both immediate patient care and the systematic resolution of the identified deficiency. This aligns with the core principles of healthcare quality, which emphasize patient safety, continuous improvement, and adherence to established standards. By initiating immediate corrective actions for the patient while simultaneously developing a plan to address the root cause of the accreditation noncompliance, the professional demonstrates a comprehensive understanding of their responsibilities. This approach ensures that the patient receives necessary care without compromising the organization's commitment to meeting accreditation requirements, which ultimately benefits all patients by fostering a culture of quality and safety. Regulatory frameworks, such as those governing accreditation bodies, expect organizations to have robust systems in place to identify, report, and remediate deficiencies. Proactive engagement with the accreditation body and a transparent approach to addressing the issue are hallmarks of best professional practice. An incorrect approach would be to ignore or downplay the accreditation deficiency to focus solely on the immediate patient situation. This failure to address the systemic issue could lead to recurring problems, potentially impacting patient care on a broader scale and jeopardizing the organization's accreditation status. Such an approach violates the ethical obligation to maintain high standards of care and could result in regulatory penalties or sanctions. Another incorrect approach would be to prioritize the accreditation requirement to the detriment of the immediate patient's needs, such as delaying necessary treatment to complete documentation for an accreditation survey. This would be a direct violation of the ethical principle of beneficence and could lead to patient harm. Furthermore, it demonstrates a misunderstanding of the purpose of accreditation, which is to enhance patient care, not to impede it. A third incorrect approach might involve falsifying information or attempting to conceal the deficiency from the accreditation body. This is not only unethical, but also a serious regulatory violation that can have severe consequences for both the individual and the organization. Professional decision-making in such situations requires a structured approach. First, assess the immediate risk to the patient and implement necessary interventions. Second, thoroughly investigate the root cause of the accreditation deficiency. Third, develop and implement a corrective action plan that addresses the root cause and prevents recurrence. Fourth, communicate transparently with relevant stakeholders, including the accreditation body, about the situation and the plan for remediation. Finally, monitor the effectiveness of the corrective actions and integrate lessons learned into ongoing quality improvement processes. Question 4. Quality control measures reveal a consistent pattern of medication errors related to dosage calculation at a specific nursing unit. What is the most appropriate next step for a certified professional in healthcare quality to take? Option A. Classify the findings as an isolated incident and monitor for future occurrences without further immediate action. Option B. Immediately issue a formal reprimand to all nursing staff on the unit for their lack of attention to detail. Option C. Implement a new, complex electronic medication administration system on the unit to address the issue. Option D. Initiate a comprehensive root cause analysis to identify contributing factors and develop targeted interventions. The correct answer is D. Initiate a comprehensive root cause analysis to identify contributing factors and develop targeted interventions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare quality professional to interpret the implications of identified quality control findings within the context of established regulatory frameworks and ethical obligations. The challenge lies in moving beyond simply identifying a deviation to understanding its potential impact on patient safety, regulatory compliance, and the overall effectiveness of care delivery. A careful judgment is required to determine the most appropriate and impactful response that aligns with the certified professional in healthcare quality, CPHQ, standards, and relevant U.S. healthcare regulations. Correct approach analysis. The correct approach focuses on a systematic, data-driven investigation to understand the root cause of the identified quality control issue. This aligns with the core principles of healthcare quality improvement, which emphasize continuous monitoring, data analysis, and evidence-based interventions. By initiating a root cause analysis, RCA, the professional is adhering to best practices mandated by regulatory bodies like the Joint Commission and CMS, which require organizations to have robust systems for identifying, analyzing, and mitigating patient safety events and quality deficiencies. This approach prioritizes patient safety and regulatory compliance by seeking to prevent recurrence and improve systemic processes, rather than merely addressing the immediate symptom. It reflects a commitment to evidence-based practice and a proactive stance on quality management. Incorrect approaches analysis. An approach that focuses solely on immediate disciplinary action without a thorough investigation fails to address the underlying systemic issues that likely contributed to the quality control finding. This is a regulatory failure, as it bypasses the requirement for organizations to implement corrective action plans based on root cause analysis. Ethically, it is unjust and ineffective, potentially leading to a cycle of repeated errors and a culture of fear rather than improvement. An approach that dismisses the finding as an isolated incident without further investigation is a significant quality and regulatory failure. Healthcare quality is not static. Isolated incidents can be indicators of broader systemic weaknesses. Regulatory bodies expect organizations to investigate all significant deviations to ensure patient safety and compliance. Ethically, this approach jeopardizes patient well-being by ignoring potential risks. An approach that involves immediate implementation of a new, unproven technology without assessing its impact or integrating it into existing workflows is a premature and potentially harmful response. This can lead to new quality issues, increased costs, and staff dissatisfaction. It fails to meet the regulatory requirement for evidence-based practice and thoughtful implementation of changes, and ethically, it risks patient safety by introducing untested interventions. Professional reasoning. Professionals should approach such situations by first acknowledging the identified quality control issue. The next step is to engage in a systematic process of data gathering and analysis, often beginning with a root cause analysis, to understand the why behind the deviation. This analysis should inform the development of targeted, evidence-based interventions. The effectiveness of these interventions must then be monitored and evaluated, creating a continuous improvement loop. This decision-making process is guided by regulatory mandates for quality improvement and patient safety, as well as ethical principles of beneficence, non-maleficence, and accountability. Question 5. Cost-benefit analysis shows that implementing a more comprehensive data collection protocol for patient falls would significantly increase staff time and associated costs, potentially delaying other quality improvement projects. However, the current, less resource-intensive method has been flagged for potential underreporting of minor falls, which approach best upholds the principles of healthcare quality and regulatory compliance. Option A. Focus on collecting data only for major falls that result in immediate harm, as these are the most critical to report and address. Option B. Seek to automate data collection through a new software system, even if the initial implementation costs are high and the system's accuracy for minor falls is not yet fully validated. Option C. Continue with the current, less resource-intensive data collection method, assuming that minor falls do not significantly impact overall patient safety metrics. Option D. Implement the more comprehensive data collection protocol, even if it requires reallocating resources or delaying other projects, to ensure accurate and complete data on patient falls. The correct answer is D. Implement the more comprehensive data collection protocol, even if it requires reallocating resources or delaying other projects to ensure accurate and complete data on patient falls. Explanation: scenario analysis. This scenario presents a classic ethical dilemma in healthcare quality, pitting potential cost savings against patient safety and data integrity. The challenge lies in balancing resource constraints with the fundamental obligation to collect accurate and comprehensive data for quality improvement. The temptation to simplify data collection for efficiency can inadvertently compromise the validity of the analysis, leading to flawed conclusions and potentially harmful interventions or missed opportunities for improvement. Professionals must navigate this tension with a strong ethical compass and a deep understanding of regulatory expectations. Correct approach analysis. The correct approach prioritizes the integrity and completeness of data collection, even if it incurs higher initial costs or requires more resources. This aligns with the core principles of healthcare quality, which demand evidence-based decision-making. Regulatory frameworks, such as those overseen by the Centers for Medicare and Medicaid Services, CMS, in the U.S., emphasize the importance of accurate data for quality reporting, performance measurement, and patient safety initiatives. Failing to collect complete data can lead to inaccurate assessments of care, misallocation of resources, and ultimately, a negative impact on patient outcomes. Ethical considerations also dictate that patients should not be disadvantaged due to data collection shortcuts. Incorrect approaches analysis. One incorrect approach involves prioritizing cost savings by excluding certain patient demographics or data points deemed less critical for the primary analysis. This is ethically problematic as it can lead to biased results, masking potential disparities in care or outcomes for excluded groups. Regulatory failure occurs because quality metrics are often designed to be inclusive and representative of the entire patient population. Another incorrect approach is to rely on anecdotal evidence or incomplete datasets to inform quality improvement initiatives. This violates the principle of evidence-based practice and can lead to ineffective or even harmful interventions. Ethically, it fails to uphold the standard of care expected for patients. A third incorrect approach might be to use data that is known to be outdated or has significant known inaccuracies, simply because it is readily available. This is a direct contravention of data integrity principles and can lead to misinformed decisions, regulatory noncompliance, and a failure to identify genuine quality issues. Professional reasoning. Professionals should employ a decision-making framework that begins with identifying the core quality objective and the data required to achieve it. This should be followed by an assessment of the resources needed for robust data collection. If resource constraints are identified, the next step is to explore alternative, ethical, and compliant methods for data collection or to advocate for the necessary resources. The decision must always be guided by the potential impact on patient safety, data validity, and regulatory compliance, rather than solely on cost efficiency. Question 6. Research into a recurring issue of medication errors in a hospital pharmacy has identified several contributing factors. A quality improvement team needs to determine the most effective strategy for addressing these errors. Which of the following approaches best aligns with regulatory expectations for systematic root cause analysis and prioritized intervention in healthcare quality? Option A. Focus solely on external best practices for medication error reduction, assuming they will directly translate to the hospital's specific operational context. Option B. Immediately implement a new dispensing system based on the most frequently cited cause of errors in staff anecdotal reports, without further systematic investigation. Option C. Address each identified cause of medication errors individually as they are discovered, without prioritizing based on impact or frequency. Option D. Construct a fishbone diagram to brainstorm all potential causes of medication errors across various categories. Then use Pareto analysis to identify and prioritize the most significant contributing factors for targeted intervention. Correct answer is D. Construct a fishbone diagram to brainstorm all potential causes of medication errors across various categories. Then use Pareto analysis to identify and prioritize the most significant contributing factors for targeted intervention. Explanation. This scenario presents a common challenge in healthcare quality improvement. identifying the root cause of a recurring problem to implement effective interventions. The professional challenge lies in moving beyond superficial observations to a systematic, data-driven analysis that aligns with regulatory expectations for patient safety and quality. Careful judgment is required to select the most appropriate quality improvement tool for the specific problem, and to ensure the analysis leads to actionable insights rather than just descriptive data. The correct approach, utilizing a fishbone diagram to explore potential causes, and then a Pareto analysis to prioritize the most significant contributing factors, represents best professional practice. This aligns with regulatory frameworks that mandate a proactive and systematic approach to identifying and mitigating risks to patient safety. For example, under U.S. regulations, the Joint Commission Standards for Performance Improvement (PI) emphasize the importance of data collection, analysis, and the implementation of evidence-based interventions to improve care. A fishbone diagram facilitates a comprehensive exploration of all potential causes across various categories, e.g., people, process, equipment, environment, ensuring no critical area is overlooked. Subsequently, Pareto analysis, based on the Pareto principle, 80/20 rule, allows quality professionals to focus resources on the vital few causes that contribute to the majority of the problem, maximizing the impact of improvement efforts. This systematic, prioritized approach is ethically sound as it directs resources efficiently towards the most impactful solutions, thereby enhancing patient outcomes and safety. An incorrect approach that focuses solely on anecdotal evidence or the most frequently mentioned cause without systematic investigation fails to meet regulatory requirements for data-driven decision-making. Such an approach risks addressing symptoms rather than root causes, leading to ineffective interventions and continued patient harm. This could be seen as a failure to adhere to the spirit of regulations like the Centers for Medicare and Medicaid Services, CMS, conditions of participation, which require hospitals to have robust quality assessment and performance improvement programs. Another incorrect approach that involves implementing a solution based on the first identified cause without further analysis or prioritization is also professionally unacceptable. This demonstrates a lack of rigor in the quality improvement process and may lead to wasted resources and a failure to address the true drivers of the problem. Ethically, this is problematic as it may not lead to the most effective improvement in patient care. A third incorrect approach that relies on external benchmarks or best practices without first understanding the specific context and root causes within the organization is also flawed. While external data can be valuable, it must be applied judiciously after an internal assessment. Without this, interventions may be misaligned with the actual issues, leading to a failure to achieve desired quality outcomes and potentially violating regulatory expectations for tailored improvement plans. The professional reasoning framework for similar situations should involve 1. Clearly defining the problem and its impact. 2. Selecting appropriate quality improvement tools based on the nature of the problem and the data available. 3. Systematically collecting and analyzing data using the chosen tools. 4. Prioritizing identified causes based on their impact and feasibility of intervention. 5. Developing and implementing evidence-based interventions. 6. Monitoring the effectiveness of interventions and making adjustments as needed. This iterative process ensures a data-driven, systematic, and effective approach to quality improvement, aligning with both regulatory mandates and ethical obligations to provide safe and high-quality patient care. Question 7. The monitoring system demonstrates a statistically significant increase in the incidence of medication errors over the past quarter, specifically related to the administration of anticoagulants. This trend has been observed across multiple units, suggesting a systemic issue rather than isolated incidents. What is the most appropriate immediate course of action for the healthcare quality professional? Option A. Initiate a comprehensive root cause analysis, RCA, involving relevant disciplines, report the trend to the Patient Safety Committee, and begin developing evidence-based interventions to address identified causal factors. Option B. Advise unit managers to conduct individual performance reviews for all staff involved in anticoagulant administration to identify and address any performance deficiencies. Option C. Recommend a temporary suspension of anticoagulant administration until a thorough review of all medication administration protocols can be completed. Option D. Classify the increase as a statistical fluctuation and continue routine monitoring without further immediate action, assuming it will self-correct? The correct answer is A. Initiate a comprehensive root cause analysis, RCA, involving relevant disciplines, report the trend to the Patient Safety Committee, and begin developing evidence-based interventions to address identified causal factors. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in healthcare quality, identifying and responding to a pattern of adverse events that may indicate systemic issues rather than isolated incidents. The professional challenge lies in moving beyond a reactive approach to a proactive one, ensuring that patient safety is paramount and that quality improvement initiatives are data-driven and effective. The urgency is amplified by the potential for continued harm if the underlying causes are not addressed. Correct approach analysis. The correct approach involves a systematic, multifaceted investigation that prioritizes patient safety and adheres to established quality improvement frameworks. This includes immediate reporting of the trend to relevant internal committees, e.g., Patient Safety Committee, Quality Improvement Council, initiating a root cause analysis, RCA, or a similar in-depth investigation to understand the contributing factors, and implementing evidence-based interventions to mitigate risks. This aligns with the principles of continuous quality improvement, CQI, and the regulatory expectation for healthcare organizations to have robust systems for identifying, analyzing, and preventing adverse events. Specifically, under U.S. regulations, organizations are mandated to have systems in place to monitor patient care and implement corrective actions when deficiencies are identified, as outlined by bodies like the Joint Commission and CMS. The focus on data analysis and evidence-based practice ensures that interventions are targeted and effective, promoting a culture of safety. Incorrect approaches analysis. One incorrect approach would be to dismiss the trend as a statistical anomaly without further investigation. This fails to meet the ethical obligation to protect patients and violates regulatory requirements for proactive quality monitoring. Such inaction could lead to continued patient harm and potential sanctions for noncompliance with quality standards. Another incorrect approach would be to implement a superficial solution, such as retraining staff without understanding the root cause of the errors. This is ineffective because it doesn't address the underlying systemic issues, which could be related to processes, equipment, or communication breakdowns. This approach is a failure of due diligence and does not represent best professional practice in quality improvement. A third incorrect approach would be to focus solely on individual accountability without a systemic review. While individual performance is important, a trend of adverse events strongly suggests broader issues. Blaming individuals without investigating systemic factors is counterproductive to creating a safe environment and can foster a culture of fear rather than a culture of safety and learning. This approach neglects the principles of systems thinking essential for effective quality improvement. Professional reasoning. Professionals facing such a scenario should employ a structured decision-making process. First, acknowledge the data and its potential implications for patient safety. Second, engage relevant internal stakeholders and quality improvement resources to initiate a formal investigation. Third, prioritize patient safety by implementing immediate, interim measures if necessary while the investigation is underway. Fourth, ensure the investigation is thorough, evidence-based, and aims to identify root causes. Finally, develop and implement sustainable, evidence-based interventions, followed by ongoing monitoring to evaluate their effectiveness. This process ensures a commitment to patient well-being and compliance with regulatory expectations for quality healthcare. Question 8. The risk matrix shows a cluster of identified patient safety risks. One risk, medication administration errors, is rated as high likelihood and high impact. Another, patient falls in hallways, is rated as high impact but low likelihood. A third, inadequate patient identification at admission, is rated as moderate likelihood and moderate impact. A fourth, delays in laundry services, is rated as high likelihood but low impact. Given these assessments and the organization's limited resources for immediate intervention, which of the following strategies best aligns with a proactive and compliant approach to risk management? Option A. Focus immediate resources on developing a comprehensive plan to prevent patient falls in hallways, as this has the highest potential impact. Option B. Implement enhanced training and double-check protocols for medication administration, and develop a targeted fall prevention program for high-risk patients. Option C. Concentrate efforts on improving patient identification processes at admission as this represents a moderate but consistent threat. Option D. Prioritize immediate interventions for delays in laundry services to address the high likelihood, low impact risk. The correct answer is B. Implement enhanced training and double-check protocols for medication administration, and develop a targeted fall prevention program for high-risk patients. Explanation: this scenario is professionally challenging because it requires balancing immediate resource constraints with the long-term implications of patient safety and regulatory compliance. A healthcare quality professional must make a judgment call on how to allocate limited resources to mitigate risks that have varying levels of impact and likelihood. The core challenge lies in prioritizing actions when not all identified risks can be addressed simultaneously. The correct approach represents best professional practice because it aligns with the fundamental principles of healthcare quality management and the regulatory framework for patient safety. By focusing on risks with high likelihood and high impact, the organization is proactively addressing the most critical threats to patient well-being and operational integrity. This proactive stance is often mandated by regulatory bodies that emphasize a systematic approach to risk identification, assessment, and mitigation. It demonstrates a commitment to continuous improvement and a data-driven approach to decision-making, which are hallmarks of effective quality management. This strategy also ensures that resources are deployed where they will have the greatest positive effect, preventing potential harm and avoiding costly adverse events. An incorrect approach that solely focuses on risks with high impact but low likelihood fails to adequately address immediate threats. While these events might be rare, their severity could be catastrophic, and neglecting them could lead to significant patient harm and regulatory sanctions for failing to implement reasonable preventive measures. This approach is ethically questionable as it prioritizes the avoidance of rare, severe events over more probable, albeit potentially less severe, harms that could affect a larger number of patients. Another incorrect approach that prioritizes risks with low impact and low likelihood, or low impact and high likelihood, is also professionally unacceptable. Focusing on low-impact risks diverts resources from more significant threats, potentially leading to a false sense of security, while critical vulnerabilities remain unaddressed. Addressing high-likelihood, low-impact risks without considering their potential cumulative effect or their interaction with other risks can be inefficient and may not significantly improve overall patient safety. This approach may also be seen as a failure to adhere to the principles of prudent risk management, which dictates that resources should be allocated to address the most significant threats first. The professional decision-making process for similar situations should involve a systematic review of the risk matrix, considering both the likelihood and impact of each identified risk. This should be followed by a collaborative discussion with relevant stakeholders, including clinical staff, risk managers, and leadership, to validate the assessment and discuss potential mitigation strategies. The decision on which risks to prioritize for immediate action should be based on a clear rationale that considers patient safety, regulatory requirements, and resource availability. A documented plan for addressing all identified risks, even those not immediately prioritized, should be developed and regularly reviewed. Question 9. Which approach would be most effective for a healthcare organization seeking to maintain and improve its accreditation status with the Joint Commission, while simultaneously enhancing patient care outcomes? Option A. Prioritizing only those accreditation standards that are directly linked to financial reimbursement and operational efficiency. Option B. Relying heavily on external consultants to interpret accreditation requirements and implement all quality improvement initiatives. Option C. Proactively integrating the Joint Commission's standards and guidelines into the organization's strategic planning, operational workflows, and staff education programs, with a focus on the underlying principles of patient safety and quality improvement. Option D. Primarily focusing on preparing for the upcoming accreditation survey by conducting mock surveys and addressing identified deficiencies in a reactive manner. The correct answer is C. Proactively integrating the Joint Commission's standards and guidelines into the organization's strategic planning, operational workflows, and staff education programs, with a focus on the underlying principles of patient safety and quality improvement. Explanation: this scenario is professionally challenging because healthcare organizations must navigate the complex landscape of accreditation standards, which are often dynamic and require continuous adaptation. Balancing the immediate demands of patient care with the long-term strategic imperative of maintaining accreditation requires careful judgment and a thorough understanding of the underlying principles of quality and safety. The role of accrediting bodies like the Joint Commission is to provide a framework for continuous improvement, not merely a checklist to be completed. The correct approach represents best professional practice because it actively integrates the accreditation standards into the organization's daily operations and strategic planning. This proactive stance ensures that quality improvement initiatives are not siloed or treated as a separate compliance burden, but rather as an intrinsic part of delivering safe and effective patient care. By focusing on the intent behind the standards, patient safety, effective care, and operational efficiency, the organization demonstrates a commitment to genuine quality improvement that transcends mere compliance. This aligns with the ethical obligation of healthcare professionals to prioritize patient well-being and adhere to established best practices, as often reflected in the core principles of accreditation bodies. An incorrect approach that focuses solely on passing the survey without embedding the principles into the organizational culture represents a significant regulatory and ethical failure. This approach treats accreditation as a transactional event rather than a continuous process, leading to superficial changes that may not be sustainable or truly impact patient outcomes. It fails to uphold the spirit of the accreditation standards, which are designed to drive meaningful improvements in healthcare delivery. Another incorrect approach, which relies on external consultants to dictate all quality initiatives, undermines the organization's internal capacity for self-assessment and improvement. This can lead to a lack of ownership and buy-in from staff, making the implemented changes less effective and potentially misaligned with the organization's unique needs and challenges. Ethically, it abdicates the organization's responsibility to foster a culture of quality internally. A third incorrect approach, prioritizing only those standards that are explicitly tied to reimbursement, demonstrates a narrow and self-serving interpretation of accreditation. This approach neglects critical aspects of patient safety and quality that may not have immediate financial implications, but are nonetheless essential for ethical and effective healthcare. It prioritizes financial gain over patient well-being, a clear ethical breach. The professional reasoning process for similar situations should involve a comprehensive understanding of the accreditation body's mission and standards, not just their literal interpretation. It requires a strategic approach that views accreditation as an opportunity for organizational learning and development. Professionals should engage in ongoing self-assessment, benchmark against best practices, and foster a culture where quality and safety are shared responsibilities. Decision-making should be guided by the principle of what is best for the patient, with accreditation standards serving as a robust framework to achieve that goal. Question 10. The review process indicates that a healthcare team is attempting to reduce the incidence of hospital-acquired infections, HI, by analyzing patient admission data and subsequent infection rates. They have collected data over the past year and are looking for a statistical method to understand if the infection rates are stable or if there are specific periods of concern that require immediate intervention. Which statistical approach would be most appropriate for this quality improvement initiative? Option A, calculating the overall average HAI rate for the year and comparing it to a national benchmark. Option B, using a simple linear regression to correlate HAI rates with the number of nursing staff on duty. Option C, creating a Pareto chart to identify the most common types of HAIs. Option D, implementing a control chart to monitor the HAI rate over time and identify deviations from expected performance. The correct answer is D, implementing a control chart to monitor the HAI rate over time and identify deviations from expected performance. Explanation: scenario analysis. This scenario presents a common challenge in healthcare quality improvement, selecting the most appropriate statistical method for analyzing data to drive meaningful change. The difficulty lies in understanding the nuances of different statistical tools and their suitability for specific types of data and quality improvement objectives. Misapplication of statistical methods can lead to incorrect conclusions, wasted resources, and ultimately, failure to achieve desired quality outcomes, potentially impacting patient safety and regulatory compliance. Correct approach analysis. The correct approach involves selecting a statistical method that aligns with the nature of the data being collected and the specific quality improvement goal. For instance, If the goal is to understand the variability of a process and identify common cause versus special cause variation, a control chart is the most appropriate tool. Control charts are fundamental in statistical process control, SPC, a widely recognized methodology for quality improvement in healthcare. They allow for the monitoring of process performance over time, distinguishing between random fluctuations and assignable causes that require investigation and intervention. This aligns with the principles of continuous quality improvement mandated by regulatory bodies that emphasize data-driven decision-making and process stability. Incorrect approach is analysis. An incorrect approach would be to use a statistical method that is not designed for process monitoring or variation analysis, such as a simple average or a Pareto chart, when the objective is to understand process stability. While a Pareto chart is useful for prioritizing problems based on frequency, it does not provide insight into process variation over time. A simple average, without considering the distribution or variability of the data, can be misleading and fail to detect shifts or trends in the process. Using such methods when control charting is indicated would be a regulatory failure because it demonstrates a lack of understanding of fundamental quality improvement methodologies and can lead to ineffective interventions, potentially violating requirements for robust quality management systems. Furthermore, it represents an ethical failure as it may lead to suboptimal patient care due to a flawed understanding of process performance. Another incorrect approach would be to apply a complex statistical model without a clear understanding of its assumptions or applicability to the healthcare context, leading to overanalysis or misinterpretation of data. This can result in a failure to meet the spirit of regulations that encourage the use of effective and appropriate quality improvement tools. Professional reasoning. Professionals should approach this decision by first clearly defining the quality improvement objective. Then, they must understand the type of data they have, e.g., continuous, discrete attribute. Based on these factors, they can then identify the most suitable statistical tool. This involves consulting established quality improvement literature and guidelines, which often recommend specific statistical methods for different quality initiatives. A systematic approach, starting with the problem definition and data characteristics, ensures that the chosen statistical method will yield valid and actionable insights, supporting regulatory compliance and ethical patient care. Question 11. The analysis reveals that a healthcare organization is conducting its annual patient safety culture assessment. Which of the following approaches would best align with regulatory expectations for a comprehensive and actionable understanding of the organization's safety culture? Option A. Reviewing leadership's perception of safety culture and comparing it to national benchmark data from similar organizations. Option B. Analyzing trends in incident reporting data and conducting targeted focus groups with frontline staff in high-risk departments. Option C. Implementing a new safety reporting system and assuming improved reporting will automatically reflect a stronger safety culture. Option D. Relying exclusively on the results of the annual staff safety culture survey to identify areas for improvement. Correct answer is B. Analyzing trends in incident reporting data and conducting targeted focus groups with frontline staff in high-risk departments. Explanation. The analysis reveals a common challenge in healthcare quality, the gap between perceived and actual patient safety culture. Organizations often rely on self-reported data, which can be influenced by social desirability bias or a lack of deep understanding of safety principles. This makes it difficult to identify systemic weaknesses and implement effective interventions. The professional challenge lies in moving beyond superficial assessments to gain actionable insights that drive meaningful improvement, ensuring compliance with regulatory expectations for a robust safety culture. The correct approach represents best professional practice because it integrates multiple data sources, including objective metrics and direct observation, to provide a comprehensive and triangulated view of the safety culture. This aligns with regulatory frameworks that mandate a proactive and data-driven approach to patient safety, emphasizing the need for evidence to support quality improvement initiatives. By looking beyond survey results, professionals can identify specific behaviors and systemic issues that impact safety, leading to targeted and effective interventions. This approach fosters accountability and transparency, crucial elements for a high-reliability organization. An incorrect approach that relies solely on annual staff surveys fails to capture the dynamic nature of safety culture and may miss critical issues that emerge between survey periods. This approach is ethically problematic as it provides an incomplete picture, potentially leading to misallocation of resources and a false sense of security regarding patient safety. It also falls short of regulatory expectations for continuous monitoring and improvement. Another incorrect approach that focuses only on incident reporting data, without context or analysis of reporting behaviors, can be misleading. High reporting rates might indicate a good culture, or they could signal a system overwhelmed with preventable errors. Conversely, low reporting rates could suggest a culture of fear or a lack of awareness, both of which are significant safety concerns. This approach lacks the depth required for effective quality improvement and may not meet regulatory standards for understanding and addressing safety culture. A third incorrect approach that prioritizes leadership perception over frontline staff feedback neglects the critical insights of those directly involved in patient care. Leadership may have a different perspective on safety, influenced by strategic goals or organizational pressures, which may not accurately reflect the day-to-day realities of patient safety. This disconnect can lead to interventions that are misaligned with actual needs, failing to foster a truly supportive safety environment, and potentially violating ethical obligations to prioritize patient well-being. The professional reasoning process for similar situation should involve a multifaceted assessment strategy. This includes 1. Defining clear objectives for the safety culture assessment, aligned with organizational goals and regulatory requirements. 2. Selecting a diverse range of assessment tools, including validated surveys, focus groups, direct observation, and analysis of safety-related data, e.g., incident reports, near misses, safety rounds. 3. Ensuring data triangulation to validate findings and identify discrepancies. 4. Involving a broad spectrum of staff at all levels of the organization in the assessment process. 5. Developing actionable improvement plans based on the comprehensive data, with clear metrics for success and accountability. 6. Regularly reassessing the safety culture to monitor progress and adapt interventions as needed. Question 12. Governance review demonstrates that the organization's approach to the merit-based incentive payment system, MIPS, reporting relies on individual clinicians self-reporting without a centralized validation process. This has led to inconsistencies in the data submitted for the quality performance category. Which of the following approaches best aligns with regulatory compliance and professional best practices for MIPS reporting? Option A. Focus solely on meeting the minimum number of required quality measures, prioritizing ease of reporting over the clinical relevance or accuracy of the data submitted. Option B. Delegate the entire responsibility for MIPS data collection and submission to the IT department, assuming they possess the technical expertise to manage the reporting requirements without direct clinical input. Option C. Continue with individual clinician self-reporting, assuming that most clinicians are aware of and adhering to MIPS requirements, and address any identified discrepancies on a case-by-case basis after the reporting period closes. Option D. Implement a robust data validation system that cross-references reported quality measure data with electronic health record, AIR, documentation and clinical workflows, alongside targeted clinician education on measure specifications and data entry best practices. The correct answer is D. Implement a robust data validation system that cross-references reported quality measure data with electronic health record, AIR, documentation and clinical workflows, alongside targeted clinician education on measure specifications and data entry best practices. Explanation. This scenario presents a common challenge in healthcare quality, ensuring accurate and compliant reporting for programs like the Merit-Based Incentive Payment System, MIPS, which replaced the Physician Quality Reporting System, PQRS. The challenge lies in balancing the demands of regulatory compliance with the practical realities of clinical workflow and data capture. Professionals must navigate complex reporting requirements, understand the nuances of measure selection, and ensure data integrity without unduly burdening clinicians or compromising patient care. Careful judgment is required to interpret program guidelines, identify appropriate quality measures, and implement robust data collection processes. The correct approach involves a proactive and systematic review of the organization's MIPS reporting strategy. This includes identifying eligible clinicians, understanding the specific MIPS categories, quality, promoting interoperability, improvement activities, cost, and selecting measures that align with the organization's patient population and clinical focus. Crucially, It requires establishing clear processes for data collection, validation, and submission, ensuring that the data accurately reflects the care provided and meets all program specifications. This approach represents best professional practice because it directly addresses the regulatory requirements of MIPS, aiming for accurate reporting to avoid penalties and maximize potential incentives. It demonstrates a commitment to quality improvement by selecting meaningful measures and ensuring data integrity, which is ethically sound and aligns with the goals of value-based care. An incorrect approach would be to assume that all eligible clinicians are automatically reporting correctly without verification. This fails to acknowledge the complexity of MIPS and the potential for errors or omissions in data collection and submission. The regulatory failure here is a lack of due diligence in ensuring compliance, which could lead to inaccurate reporting, financial penalties, and a failure to demonstrate quality performance. Another incorrect approach would be to focus solely on meeting the minimum reporting requirements without considering the strategic implications of measure selection. This might involve choosing measures that are easy to report, but do not truly reflect the quality of care provided or the organization's improvement priorities. The ethical failure lies in potentially misrepresenting the organization's quality performance and not actively pursuing meaningful quality improvement. A third incorrect approach would be to delegate the entire responsibility for MIPS reporting to a single department or individual without adequate oversight or integration with clinical operations. This can lead to a disconnect between clinical practice and reporting requirements, resulting in incomplete or inaccurate data. The regulatory failure is the lack of a comprehensive compliance strategy, and the ethical failure is the potential for a lack of accountability and transparency in the reporting process. The professional reasoning process for similar situations should involve a multifaceted approach. 1. Understand the regulatory landscape. Thoroughly review the specific requirements of the relevant quality reporting program, e.g. MIPS. 2. Assess organizational readiness. Evaluate current data collection processes, IT infrastructure, and staff knowledge. 3. Develop a strategic reporting plan. Identify eligible clinicians, select appropriate measures, and define reporting pathways. 4. Implement robust data management. Establish clear protocols for data capture, validation, and quality assurance. 5. Foster interdisciplinary collaboration. Engage clinicians, IT, and administrative staff in the reporting process. 6. Conduct regular audits and reviews. Periodically assess reporting accuracy and compliance. 7. Stay informed of program changes. Continuously monitor updates and modifications to reporting requirements. Question 13. The efficiency study reveals a statistically significant decline in a key performance indicator, KPI, related to patient adherence to post-discharge medication regimens, a metric heavily weighted in a national quality initiative. While the data accurately reflects the current situation, the quality director is under immense pressure from executive leadership to demonstrate progress towards the initiative's targets for the upcoming reporting period. The director is considering several immediate actions to address the KPI. Which of the following actions best aligns with the principles of professional healthcare quality and ethical practice in the context of national quality initiatives? Option A. Focus all immediate efforts on developing a new, more favorable KPI that is less sensitive to adherence issues, and advocate for its adoption in future reporting cycles to better reflect the organization's overall quality efforts. Option B. Initiate a focused root cause analysis to understand the factors contributing to the decline in medication adherence, involving frontline staff and patient feedback, and develop targeted interventions based on the findings. Option C. Recommend a review of the data collection process to identify potential systemic errors or biases that may be contributing to the observed decline, while simultaneously exploring educational outreach to patients about medication importance. Option D. Propose to the executive leadership a temporary adjustment to the data reporting methodology, such as excluding patients with complex comorbidities from the adherence calculation for the current reporting cycle, to improve the reported metric. Correct answer is B. Initiate a focused root cause analysis to understand the factors contributing to the decline in medication adherence, involving frontline staff and patient feedback, and develop targeted interventions based on the findings. Explanation. This scenario presents a professional challenge because it pits the drive for measurable quality improvement against the potential for unintended consequences and the ethical imperative to avoid misrepresentation. The certified professional in healthcare quality, CPHQ, must navigate the tension between achieving targeted performance metrics and ensuring that the data accurately reflects patient care and outcomes. The pressure to meet benchmarks, especially those tied to reimbursement or public reporting, can create an environment where subtle or even overt manipulation of data becomes tempting. Careful judgment is required to uphold the integrity of quality initiatives and patient trust. The correct approach represents best professional practice because it prioritizes transparency, accurate data collection, and a holistic understanding of quality. By focusing on root cause analysis of the observed trend and engaging relevant stakeholders, the professional demonstrates a commitment to genuine improvement rather than superficial metric manipulation. This aligns with the ethical principles of honesty and integrity fundamental to healthcare quality and implicitly supports the intent of national quality strategies like those promoted by the National Quality Forum, NQF, which aim for meaningful and sustainable improvements in patient care. The focus remains on understanding and addressing the underlying issues affecting patient care, rather than simply altering reporting to meet a target. An incorrect approach that focuses solely on adjusting reporting thresholds or excluding specific patient populations to meet targets is professionally unacceptable. This constitutes data manipulation and misrepresentation, violating ethical standards of honesty and integrity. It undermines the credibility of quality reporting and the national quality initiatives themselves, as it creates a false impression of improved performance. Such an approach also fails to address the actual care delivery issues that led to the observed trend, potentially harming patients by masking underlying problems. Furthermore, it could violate regulations governing healthcare data integrity and reporting accuracy, leading to penalties and loss of trust. Another incorrect approach that involves selectively highlighting positive data points while downplaying negative trends is also ethically flawed. This selective reporting is a form of deception, creating a biased and incomplete picture of quality. It fails to provide a true measure of performance and prevents meaningful learning and improvement. This practice directly contradicts the principles of accountability and transparency inherent in quality improvement frameworks. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the discrepancy. Clearly recognize the gap between the observed data and the expected performance. 2. Investigate the root cause. Do not assume the data is simply wrong. Conduct a thorough investigation to understand why the trend is occurring. This involves examining clinical processes, patient factors, data collection methods, and system-level issues. 3. Consult relevant stakeholders. Engage clinicians, data analysts, administrators, and potentially patient representatives to gain diverse perspectives and insights. 4. Prioritize patient well-being and data integrity. Ensure that any proposed solutions genuinely improve patient care and do not compromise the accuracy or completeness of data. 5. Adhere to ethical and regulatory guidelines. Always operate within the established ethical codes and legal frameworks governing healthcare quality and reporting. 6. Communicate transparently. Report findings and proposed actions honestly and clearly to all relevant parties. Question 14. During the evaluation of a new patient safety protocol aimed at reducing medication errors, a quality improvement team identifies that while the protocol is being consistently documented as followed, the actual incidence of reported medication errors has not significantly decreased. The team is considering several next steps. Which of the following represents the most appropriate and effective approach to address this discrepancy? Option A. Conduct a root cause analysis to understand why the protocol, despite being documented, is not leading to the expected reduction in errors, and use these findings to refine the protocol or its implementation. Option B. Increase the frequency of audits to ensure staff are more rigorously adhering to the documented protocol, believing that better adherence will automatically reduce errors. Option C. Conclude that the protocol is inherently ineffective and propose its immediate discontinuation without further investigation into implementation or underlying issues. Option D. Assume the reporting system for medication errors is flawed and focus on improving the accuracy of error reporting rather than the protocol itself. The correct answer is A. Conduct a root cause analysis to understand why the protocol, despite being documented, is not leading to the expected reduction in errors, and use these findings to refine the protocol or its implementation. Explanation. This scenario presents a common implementation challenge in healthcare quality, balancing the need for standardized processes with the reality of diverse patient populations and clinical contexts. The professional challenge lies in ensuring that quality improvement initiatives are not only compliant with regulatory requirements, but also effective and equitable in practice. Careful judgment is required to avoid unintended consequences, such as creating barriers to care or overlooking critical patient needs. The correct approach represents best professional practice because it prioritizes a data-driven, iterative, and patient-centered methodology. This aligns with the core principles of healthcare quality improvement, which emphasize continuous learning, adaptation, and responsiveness to evidence. Specifically, it reflects the regulatory expectation within the U.S. healthcare framework, as implied by the CPHQ exam context, to demonstrate measurable improvements in patient outcomes and safety, while also adhering to ethical obligations of providing equitable care. This approach fosters a culture of quality by engaging stakeholders and ensuring that interventions are tailored to address identified gaps effectively. An incorrect approach that focuses solely on achieving a specific metric without understanding the underlying causes or patient impact is professionally unacceptable. This could lead to superficial improvements that do not address systemic issues, potentially violating regulations that require demonstrable patient benefit and safety. Another incorrect approach that disregards patient feedback or clinical context risks creating processes that are not feasible or are detrimental to patient care, failing to meet ethical standards of beneficence and non-maleficence. Furthermore, an approach that relies on anecdotal evidence or personal opinion rather than systematic data collection and analysis undermines the scientific basis of quality improvement and can lead to misallocation of resources and ineffective interventions, potentially contravening regulatory mandates for evidence-based practice. Professionals should employ a decision-making framework that begins with a thorough understanding of the quality problem, including its scope, impact, and root causes, supported by robust data. This should be followed by the development of evidence-based interventions, pilot testing, and continuous monitoring of outcomes. Engaging relevant stakeholders, including frontline staff and patients, throughout the process is crucial for ensuring buy-in, identifying potential barriers, and refining interventions for optimal effectiveness and equity. This iterative process, grounded in data and patient experience, is essential for navigating the complexities of healthcare quality improvement and ensuring compliance with regulatory and ethical standards. Question 15. Process analysis reveals that a healthcare organization is implementing a new patient safety protocol aimed at reducing medication errors. The quality improvement team needs to engage various stakeholders, including frontline nurses, physicians, pharmacists, hospital administrators, and patient advocacy groups, to ensure successful adoption and adherence. Which of the following strategies best addresses the diverse communication needs and engagement levels of these distinct stakeholder groups? Option A. Develop a comprehensive communication plan that includes tailored informational materials, targeted feedback mechanism, and dedicated engagement sessions for each stakeholder group, acknowledging their unique roles, concerns, and preferred communication channels. Option B. Disseminate a single, detailed policy document via email to all staff and patient advocacy groups, assuming that all parties will read and understand the information independently. Option C. Focus communication efforts primarily on hospital administrators and department heads, assuming they will effectively cascade information and ensure compliance among their teams. Option D. Conduct a single town hall meeting for all stakeholders to present the new protocol, followed by a general queue and a session, and rely on individual initiative for further understanding and implementation. The correct answer is A. Develop a comprehensive communication plan that includes tailored informational materials, targeted feedback mechanisms, and dedicated engagement sessions for each stakeholder group, acknowledging their unique roles, concerns, and preferred communication channels. Explanation. This scenario presents a common challenge in healthcare quality improvement, effectively engaging diverse stakeholders with potentially competing priorities and varying levels of understanding regarding quality initiatives. The professional challenge lies in tailoring communication and engagement strategies to ensure buy-in, accurate comprehension, and active participation from all relevant parties, from frontline staff to executive leadership and patient representatives. Failure to do so can lead to resistance, misinterpretation of goals, and ultimately, the ineffectiveness of quality improvement efforts. The correct approach emphasizes a multifaceted strategy that acknowledges the unique perspectives and communication preferences of each stakeholder group. This aligns with best practices in stakeholder management and ethical healthcare delivery, which mandate transparency, inclusivity, and responsiveness. By providing tailored information through appropriate channels, e.g., direct feedback mechanisms for frontline staff, data-driven reports for leadership, accessible language for patients. This approach fosters trust and ensures that all stakeholders feel valued and informed. This promotes a shared understanding of quality goals and facilitates collaborative problem solving, which is crucial for sustainable quality improvement. Incorrect approaches fail to recognize the importance of tailored communication and stakeholder-specific engagement. One incorrect approach might involve a one-size-fits-all communication strategy, such as a single mass email or general meeting, which fails to address the specific needs and concerns of different groups. This can lead to disengagement, a perception of being overlooked, and a lack of understanding of how the quality initiative directly impacts their roles or experiences. Ethically, this can be seen as a failure to adequately inform and involve those affected by the quality improvement process. Another incorrect approach might be to only engage a select few key stakeholders, neglecting broader input from frontline staff or patient advocacy groups. This can result in a disconnect between the initiative's design and its practical implementation or patient experience, potentially leading to unintended negative consequences and a lack of buy-in from those most impacted. This also represents a failure in inclusive governance and patient-centered care principles. The professional reasoning process for similar situations should involve a thorough stakeholder analysis to identify all relevant parties, their interests, their influence, and their preferred communication methods. Based on this analysis, a tailored engagement plan should be developed, outlining specific communication channels, content, and frequency for each group. Regular feedback loops should be established to monitor engagement levels and adapt strategies as needed. This iterative process ensures that communication remains effective and that stakeholder concerns are addressed proactively, fostering a collaborative environment for quality improvement. Question 16. Process analysis reveals a consistent pattern of delays in patient discharge summaries being completed, leading to potential communication gaps between inpatient and outpatient care teams. Which quality improvement model, when applied with a focus on iterative testing and data-driven adjustments, best aligns with the regulatory expectation for timely and accurate patient information flow in U.S. healthcare settings? Option A. Mandating immediate, full-scale implementation of a new, complex electronic health record module designed to automate discharge summaries without prior pilot testing. Option B. Relying on informal feedback from physicians and nurses to identify and implement ad hoc solutions to the discharge summary delay issue. Option C. Conducting a series of intensive, statistically rigorous Six Sigma DMAIC, define, measure, analyze, improve, control projects focused on every potential variable contributing to delays without prioritizing immediate interventions. Option D. Implementing a Plan, Do, Study, Act (PDSA) cycle to test interventions such as standardized templates or electronic notification systems for discharge summary completion. The correct answer is D. Implementing a Plan, Do, Study, Act (PDSA) cycle to test interventions such as standardized templates or electronic notification systems for discharge summary completion. Explanation. This scenario presents a common challenge in healthcare quality improvement, selecting the most appropriate model for a specific problem. The professional challenge lies in understanding the nuances of each model and aligning them with the regulatory expectations for patient safety and process efficiency within the U.S. healthcare system, as governed by bodies like CMS and the Joint Commission. Careful judgment is required to ensure the chosen model not only addresses the identified issue, but also adheres to established quality standards and reporting requirements. The correct approach represents best professional practice because it directly applies a structured, iterative methodology proven effective for identifying and addressing variations in care. The Plan, Do, Study, Act (PDSA) cycle, a core component of the model for improvement, is widely recognized and encouraged by U.S. healthcare regulatory frameworks for its adaptability to various quality issues, from minor process tweaks to larger system changes. Its emphasis on testing changes on a small scale before widespread implementation minimizes risk and allows for data-driven adjustments, aligning with the regulatory imperative to improve patient outcomes and reduce errors. This approach fosters a culture of continuous learning and evidence-based practice, which is a cornerstone of quality healthcare delivery under U.S. regulations. An incorrect approach that focuses solely on a rapid, top-down implementation without adequate testing or data collection fails to meet regulatory expectations for evidence-based practice and patient safety. This could lead to unintended consequences or the failure to identify root causes, potentially violating guidelines that mandate demonstrable improvements and risk mitigation. Another incorrect approach that prioritizes a complex, statistically driven methodology like Six Sigma, without a clear understanding of the specific problem's complexity or the organization's capacity for data analysis, might be overly resource-intensive and fail to yield timely improvements, thus not optimally addressing the regulatory drive for efficient and effective quality enhancement. A third incorrect approach that relies on anecdotal evidence or personal opinion rather than systematic data collection and analysis directly contravenes the principles of quality improvement mandated by U.S. healthcare regulations, which emphasize objective measurement and data-driven decision-making. Professionals should employ a decision-making framework that begins with a thorough understanding of the problem, its scope, and its potential impact on patient care. This should be followed by an assessment of available resources, organizational capacity, and the specific requirements of relevant regulatory bodies, evaluating the suitability of different quality improvement models against these factors, considering their strengths and weaknesses in relation to the problem and regulatory landscape, will guide the selection of the most effective and compliant approach. The chosen model should facilitate systematic data collection, analysis, and iterative testing to ensure sustainable improvements and adherence to quality standards. Question 17. Regulatory review indicates that a proposed initiative to streamline medication reconciliation processes has encountered significant resistance from the nursing staff, who express concerns that the new electronic system will increase their workload and detract from direct patient interaction. As the quality improvement lead, what is the most appropriate approach to address this stakeholder dynamic and ensure the initiative's success? Option A. Convene a working group comprised of nursing staff, pharmacists, and IT specialists to collaboratively redesign the workflow, incorporating their feedback into the final system configuration and implementation plan. Option B. Commission an independent external review of similar successful medication reconciliation systems in other healthcare organizations to validate the proposed approach and present these findings to the nursing staff. Option C. Proceed with the implementation of the new electronic system as planned, providing mandatory training sessions to ensure compliance, and address any persistent issues through individual performance management. Option D. Acknowledge the nursing staff's concerns but proceed with the implementation, emphasizing the regulatory mandate for improved patient safety and the potential for future efficiency gains. The correct answer is A. Convene a working group comprised of nursing staff, pharmacists, and IT specialists to collaboratively redesign the workflow, incorporating their feedback into the final system configuration and implementation plan. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare quality improvement, where a well-intentioned initiative faces resistance from a key stakeholder group due to perceived negative impacts on their workflow and autonomy. The challenge lies in balancing the organizational goal of improving patient safety with the need to maintain positive working relationships and ensure buy-in from frontline staff. Effective leadership in quality improvement requires navigating these interpersonal dynamics and fostering a collaborative environment, rather than imposing changes unilaterally. Correct approach analysis. The correct approach emphasizes a collaborative and inclusive strategy. By actively involving the nursing staff in the redesign process, their concerns are acknowledged and addressed directly. This aligns with principles of shared governance and evidence-based practice in quality improvement, which advocate for frontline staff participation in decision-making that affects their work. This approach fosters ownership, increases the likelihood of successful implementation, and respects the expertise of those directly involved in patient care, thereby upholding ethical obligations to both patients and staff. It also implicitly supports regulatory frameworks that encourage a culture of safety and continuous improvement through staff engagement. Incorrect approaches analysis. One incorrect approach involves proceeding with the implementation without addressing the nursing staff's concerns. This demonstrates a failure to engage key stakeholders, potentially violating ethical principles of respect for persons and their professional contributions. It can lead to decreased morale, resistance, and ultimately, the failure of the quality initiative, undermining the organization's commitment to patient safety and regulatory compliance that often mandates effective quality programs. Another incorrect approach is to dismiss the nursing staff's feedback as mere resistance to change. This shows a lack of understanding of team dynamics and the importance of addressing legitimate operational concerns. It can be seen as a failure to uphold professional responsibility to create a supportive work environment, and can lead to a breakdown in trust, hindering future quality improvement efforts and potentially violating ethical guidelines related to fair treatment of employees. A third incorrect approach is to seek external validation for the proposed changes without engaging the affected staff. While external expertise can be valuable, bypassing the input of those who will implement the changes is a significant oversight. This approach fails to leverage internal knowledge and can result in solutions that are impractical or create new problems, demonstrating a lack of due diligence in the quality improvement process and potentially failing to meet regulatory expectations for robust and practical quality initiatives. Professional reasoning. Professionals should approach such situations by first actively listening to and understanding the concerns of all stakeholders. This involves open communication, empathy, and a willingness to adapt the proposed solution based on feedback. A structured approach involving a multidisciplinary team, data collection to validate concerns, and iterative piloting of solutions is crucial. Professionals must prioritize building trust and fostering a collaborative spirit, recognizing that successful quality improvement is a team effort, not a top-down mandate. This aligns with ethical obligations to promote well-being and ensure effective, safe patient care through collaborative means. Question 18. The control framework reveals that a healthcare leader must decide which of two quality initiatives to champion with limited resources. Initiative A focuses on implementing a new evidence-based protocol for sepsis management, which has demonstrated a significant reduction in mortality rates in peer-reviewed studies and is expected to reduce hospital readmissions. Initiative B involves upgrading the hospital's patient satisfaction survey software, which is anticipated to improve patient feedback collection, but has no direct evidence linking it to improved clinical outcomes or reduced adverse events. The leader must select the initiative that best aligns with regulatory requirements and best practices for quality improvement. Option A. Champion the sepsis management protocol, as it directly addresses patient safety and has a clear potential for improved clinical outcomes and reduced readmissions, aligning with regulatory mandates for patient care quality. Option B. Champion the patient satisfaction survey software upgrade, as improving patient feedback is a key component of overall healthcare quality and patient experience. Option C. Champion the initiative that requires the least upfront investment, regardless of its direct impact on patient safety or clinical outcomes. Option D. Champion the sepsis management protocol, but delay its implementation until further research can definitively prove its cost-effectiveness in this specific hospital setting. Correct answer is A. Champion the sepsis management protocol, as it directly addresses patient safety and has a clear potential for improved clinical outcomes and reduced readmissions, aligning with regulatory mandates for patient care quality. Explanation. This scenario presents a common challenge in healthcare quality improvement, balancing competing priorities and resource allocation under the guidance of regulatory mandates. The professionally challenging aspect lies in the healthcare leader's responsibility to champion quality initiatives, while simultaneously ensuring operational efficiency and compliance with the Certified Professional in Healthcare Quality (CPHQ) framework, which emphasizes patient safety, evidence-based practice, and continuous improvement. The leader must make a judgment call that aligns with the CPHQ core principles and applicable U.S. healthcare regulations, such as those from CMS Centers for Medicare and Medicaid Services and the Joint Commission, without compromising patient care or financial viability. The correct approach, which involves prioritizing a quality initiative with demonstrable patient safety benefits and a clear return on investment (ROI), in terms of reduced adverse events and improved patient outcomes, represents best professional practice. This aligns with the CPHQ emphasis on data-driven decision-making and the regulatory imperative to reduce preventable harm. By focusing on an initiative that directly impacts patient safety and can be justified through improved outcomes and potential cost savings, e.g., reduced readmissions, fewer complications, the leader demonstrates a commitment to both quality and fiscal responsibility, a key tenet of effective healthcare leadership under U.S. regulations. An incorrect approach that focuses solely on cost reduction without considering the impact on quality or patient safety would be a significant regulatory and ethical failure. This could violate CMS conditions of participation and the Joint Commission's accreditation standards, which mandate a focus on patient safety and quality outcomes. Another incorrect approach, prioritizing an initiative with a high perceived but unproven impact on quality, without a clear data-driven rationale or a robust evaluation plan, would also be problematic. This demonstrates a lack of adherence to the CPHQ requirement for evidence-based practice and can lead to wasted resources and a failure to address actual quality gaps. Ignoring the potential for a positive ROI, even if it requires initial investment, could also be a failure to optimize resource allocation for quality improvement, potentially hindering the organization's ability to sustain and expand its quality efforts. Professionals should employ a decision-making framework that involves 1. Identifying quality improvement opportunities aligned with organizational strategic goals and regulatory requirements. 2. Gathering and analyzing data to assess the potential impact and feasibility of each initiative. 3. Evaluating the potential ROI, including both clinical outcomes and financial implications. 4. Engaging stakeholders to gain buy-in and ensure successful implementation. And 5. Establishing clear metrics for monitoring progress and demonstrating success, all within the context of U.S. healthcare regulations and CPHQ standards. Question 19. Governance review demonstrates a recurring pattern of patient dissatisfaction related to communication during care transitions. While existing patient satisfaction surveys show a slight decline in scores for this specific area, the underlying reasons for this dissatisfaction remain unclear. What is the most appropriate next step to effectively address this quality issue? Option A. Implement a new, more frequent quantitative survey to track patient satisfaction scores related to communication. Option B. Analyze existing incident reports for keywords related to communication breakdowns during transitions. Option C. Conduct in-depth patient interviews and focus groups to explore their experiences and perceptions of communication during care transitions. Option D. Rely on the clinical team's anecdotal feedback to identify areas for communication improvement. The correct answer is C. Conduct in-depth patient interviews and focus groups to explore their experiences and perceptions of communication during care transitions. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare quality improvement, selecting the most appropriate data type to understand and address a complex issue. The governance review has identified a potential problem, but the nature of the problem requires careful consideration of whether quantitative or qualitative data will yield the most actionable insights. The challenge lies in moving beyond superficial observations to a deeper understanding of patient experiences and systemic issues that might not be captured by numbers alone. Correct approach analysis. The correct approach involves prioritizing qualitative data collection. This is best professional practice because it allows for a nuanced exploration of patient experiences, perceptions, and the underlying reasons for dissatisfaction or adverse events. Qualitative data, such as patient interviews, focus groups, and open-ended survey responses, can uncover the why behind the numbers. For example, while quantitative data might show an increase in patient complaints about wait times, qualitative data can reveal the specific stressors, communication breakdowns, or environmental factors contributing to this perception. This deeper understanding is crucial for developing targeted and effective quality improvement interventions that address the root causes, aligning with ethical obligations to provide patient-centered care and regulatory expectations for thorough root cause analysis. Incorrect approaches analysis. Focusing solely on quantitative data, such as patient satisfaction scores or incident report frequencies, is an incorrect approach because it may provide a superficial overview but fail to explain the underlying issues. This can lead to the implementation of ineffective interventions that do not address the true drivers of poor quality. For instance, simply aiming to reduce the number of reported incidents without understanding the context of those incidents, could miss critical safety concerns. Relying on existing quantitative data without seeking further qualitative insights represents a failure to conduct a comprehensive assessment, potentially violating standards of care and patient safety protocols that mandate a thorough understanding of quality issues. Another incorrect approach would be to dismiss the need for data altogether and rely on anecdotal evidence or assumptions. This is ethically unsound and professionally irresponsible, as it bypasses systematic evaluation and evidence-based decision-making. It fails to meet regulatory requirements for data-driven quality improvement and can lead to biased conclusions and misallocation of resources. Finally, an incorrect approach would be to collect both quantitative and qualitative data, but fail to integrate them effectively. This would result in a fragmented understanding of the quality issue, where the two data types are not used synergistically to inform a holistic improvement strategy. This represents a missed opportunity for robust analysis and a failure to leverage the full potential of data in quality improvement efforts. Professional reasoning. Professionals should approach this situation by first understanding the nature of the problem identified by the governance review. If the problem involves patient experience, satisfaction, or complex process breakdowns, qualitative data should be prioritized to gain depth and context. This should be followed by a consideration of relevant quantitative data to establish baseline metrics and track progress. The decision-making process should involve a multidisciplinary team, including quality improvement specialists, clinicians, and patient representatives, to ensure a comprehensive perspective. The goal is to gather data that is not only measurable but also meaningful, leading to actionable insights that improve patient outcomes and experiences. This aligns with the principles of continuous quality improvement and the ethical imperative to provide safe, effective, and patient-centered care. Question 20. Implementation of a new patient discharge process has resulted in an increase in readmission rates for a specific patient population. The quality improvement team needs to analyze the contributing factors to this increase. Which performance improvement tool will be most effective in systematically identifying the underlying causes of this process breakdown? Option A. A Pareto chart to identify the most frequent reasons for readmission, assuming the data is already categorized. Option B. A run chart to track the readmission rate over time and identify trends. Option C. A scatter plot to examine the relationship between the length of stay and readmission rates. Option D. A fishbone diagram, Ishikawa diagram, to explore potential causes across different categories such as people, process, equipment, and environment. The correct answer is D. A fishbone diagram, Ishikawa diagram, to explore potential causes across different categories such as people, process, equipment, and environment. Explanation. This scenario presents a common challenge in healthcare quality improvement, selecting the most appropriate tool to analyze a complex process issue. The difficulty lies in understanding the nuances of each tool and how they align with the specific nature of the problem and the desired outcome. Careful judgment is required to avoid misapplication, which can lead to wasted resources, ineffective solutions, and potential noncompliance with quality standards. The correct approach represents best professional practice because it directly addresses the need for a systematic, data-driven investigation of a process with multiple contributing factors. This aligns with regulatory expectations for quality improvement initiatives, which emphasize evidence-based decision-making and a thorough understanding of root causes. By focusing on identifying the underlying reasons for variation and potential defects, this tool facilitates targeted interventions that are more likely to yield sustainable improvements. This approach is ethically sound as it prioritizes patient safety and optimal care delivery by seeking to eliminate preventable errors. An incorrect approach that focuses solely on identifying symptoms without exploring root causes fails to meet the analytical depth required by quality improvement frameworks. This can lead to superficial fixes that do not address the fundamental issues, potentially resulting in recurring problems and a failure to achieve meaningful quality gains. Ethically, this approach is deficient as it may not adequately protect patients from harm if the underlying causes of adverse events are not addressed. Another incorrect approach that relies on anecdotal evidence or personal opinions rather than objective data is professionally unacceptable. Regulatory bodies and quality standards mandate the use of data to inform improvement efforts. Relying on subjective information can lead to biased conclusions and ineffective interventions, undermining the integrity of the quality improvement process. This approach also poses an ethical risk by potentially overlooking critical data that could reveal systemic issues impacting patient care. A further incorrect approach that involves implementing solutions without a clear understanding of the problem's scope or contributing factors is also problematic. This shotgun approach is inefficient and unlikely to be effective. It demonstrates a lack of analytical rigor and can lead to the implementation of interventions that are irrelevant or even detrimental to the process. Ethically, this can be seen as a failure to exercise due diligence in ensuring that interventions are evidence-based and designed to improve patient outcomes. The professional reasoning process for similar situations should involve a systematic evaluation of the problem, followed by a deliberate selection of the most appropriate performance improvement tool. This includes understanding the strengths and limitations of various tools, considering the type of data available, and aligning the tool's application with the specific objectives of the quality improvement initiative. Professionals should prioritize tools that facilitate root cause analysis and support data-driven decision-making, ensuring compliance with regulatory requirements and ethical obligations to provide safe and effective care.